Medical Surgical Clinic is a 40 physician, almost 50 medical provider, true multi-specialty practice. We have 8 physical locations in Irving and Las Colinas. And actually, I sort of stumbled upon Ideal Protein at a Texas MGMA meeting. And when I met with the representatives who were there, I was just intrigued by the science, and then understanding more about the protocol itself and that how well it was laid out and that it was physician developed, and you know, all the science that was behind the program and why it was so successful. You know, obviously our physicians from the clinical perspective were incredibly impressed. And that then tended to make it a much more easy conversation to get into is this something that we should be offering?
I've been at the Medical and Surgical Clinic of Irving for about the last 11 years, practicing general internal medicine. We see a lot of improvements in our patients' health that have been on these programs. Specifically, marked reduction of blood sugar values and hemoglobin A1C levels, sometimes into normal ranges, and medications can be discontinued or greatly reduced. We see improvement of blood pressure and especially lipid profiles. The changes you see in triglycerides and LDL values in particular are amazing when someone's on the Ideal Protein weight loss method, particularly in ketosis in the weight loss phase. We see dramatic improvements, and we're able to decrease medications in a lot of situations.
For years, you know, your physicians are prescribing diet and exercise, but really didn't have a tool to give the patient. You need those mechanisms to deliver on the changes that are going to be documented. If you're evaluating quality, how are you going to evaluate quality? Well, you know, they're looking at the QIS information is looking at results on reductions in blood pressure, reductions in hemoglobin A1C, changes in triglyceride measurements, changes in other lipid measurements, in cholesterol levels and such. All of those things are just a perfect dovetail off of what Ideal Protein does.
I've come to recognize the importance of lifestyle changes in managing numerous chronic medical problems that our patients have. Losing weight is integral to management of diabetes, hypertension, metabolic syndrome, and having an effective program to help our clients and patients with these problems is integral to helping them with these chronic issues. The Ideal Protein program has been tremendously effective at helping people reduce the metabolic effects that we see, reducing triglycerides, increasing HDL cholesterol, reducing inflammation in their bodies, helping them with sleep apnea and musculoskeletal symptoms and even mood-related symptoms. Within my practice, it's been an ideal approach and much more effective than traditional approaches and previous diets that I've recommended.
Clinically, our physicians have been incredibly impressed with the outcomes that they've seen from their patients that have participated. Reductions in the need for hypertensive medication, changes in the need for diabetic medication, cholesterol medications and such have just been incredible. We've probably served in excess of 1,000 participants up to this point, and the doctors are just incredibly impressed with the outcomes.
I have lost 102 pounds and it took me, I started like the day after Christmas, so I started at the end of December and I reached my goal in November, beginning of November, yeah.
I lost 120 pounds in 42 weeks with Ideal Protein. I was a dieter and I actually had been through many other diets before, but I didn't lose the weight and maintain the weight loss. This program provided me the opportunity to get education on how to keep the weight off, so I actually lost the weight and maintained the weight loss.
I have found that women have struggled losing weight, and it is more difficult for women to sometimes lose weight than men. They've been discouraged by other programs that have not been as effective. And certain demographics of women, particularly women who may have polycystic ovarian syndrome and an underlying insulin resistance, have done tremendously well with this program. It particularly addresses an underlying physiologic reason why that demographic has had difficulty with the underlying insulin resistance, and this being a low carbohydrate diet, I found it to be extremely effective.
The time that I heard the information seminar, I recognized that many of the things that I was trying to do as a dieter were not right, and they weren't based in science. And so when Ideal Protein says to us the program is predictable, it is measurable, and is repeatable, they are exactly right. Our average population age is probably closer to 50, and we have a lot of senior citizens in their 60s and 70s who are doing our diet. Again, based on the fact that our doctors have learned the health benefits and everything that has been so good about the program and had specific patients in mind.
The Ideal Protein program is an all-natural way to lose weight. We offer protein and vegetables, and there's no medications added that could be added at other times. I like that they are able to do this program in a way that is where you're providing you with a way to learn how to eat now and to eat in the future, where you're just eating food in the proper times and the proper places.
When your physician goes over a weight loss program with you and tells you, I expect that you're going to have this amount of weight loss over a certain amount of time, and that happens, there's a great deal of satisfaction for your patients in that. And they're much more likely to stay on path and stay on track with this healthcare journey.
You always see these success stories and, you kind of roll your eyes and, yeah, it worked for one person, but, this is one of those. And it's cliche, but if it worked for me, it can work for anybody. I mean, if I can do this, anybody can do this. I mean, I have never, before this program, I never lost weight. I never, I just assumed that I might lose a little bit, but I would never, ever lose 100 pounds. I'm never going to be that person, Yes, I highly recommend this program. It is an amazing, amazing program. There's nothing else like it.
A program like Ideal Protein is really going to provide the physicians with an opportunity to address some of the things that are confronting the healthcare industry as a whole. Then move toward patient-centered medical homes, toward accountable care organizations, quality-based reimbursement. All of those things they fit so synergistically into what Ideal Protein brings to the practice. The scenario of what organizations are going to continually confront with changes in reimbursement, delivering quality and the quality outcomes having an impact on the doctor's ability to get paid, you need these kinds of tools, you need these kinds of resources to be able to actually have an impact on your patient's health.